You have the same problem with sleep, to be honest. Do you have insomnia? You don't have any diagnosed sleeping problems, but you have trouble falling asleep. And then even if you get enough time sleeping, you will still be super tired during the day sometimes. How old are you, Cindy? If you don't mind me asking. You're 20, turning 21 this year. Okay. It might be hormonal because you're a woman, so you've heard a lot of women have the same problems because of hormones. Maybe. Yeah, I wouldn't be... I wouldn't know much about that area. At least I would be coming from like my own thing. So, Cindy, the reason why I asked your age is because I've been dealing with sleep struggles since I was in middle school. So like since I was like 12 or something. Does that make sense? Are people like 11 years old in 7th grade? I don't know. Like I always struggle with this kind of math. Like what age are you at this grade level? Like, you know? Falling asleep is your biggest problem right now. You have no trouble staying asleep, but falling asleep is waking up is so hard. Yeah, for me it's getting to sleep, because the falling asleep part, like once I initiate the part of like my bedtime like routine, then I usually don't struggle to fall asleep. There have been exceptions this past week though. There's one night where I couldn't fall asleep until 4 a.m. and I was just laying there waiting to fall asleep. It was I hate that. You've had sleeping problems since you were 12. You were napping 3 to 9 hours a day after school and then sleeping the whole night. Damn, that's a lot of sleep. Actually, I'm kind of sus. That sounds kind of sus. Okay. There's a reason why I'm saying that. Because that's really similar to my experience in my early 20s. I would go to school and then I would be a zombie in school, a functional zombie though. Because, you know, I was a teenager at least, like I could tolerate super low levels of sleep. On average in high school, I got 2 hours of sleep a night. It was really bad. Caffeine wouldn't do anything. Like coffee, nothing. Like it would just make me sleepy but faster. Just a lot more anxious, honestly. After school, I would immediately just take a nap for like 3-4 hours, and then I would struggle to do homework, and then I would struggle to fall asleep, and then yeah. In college, I figured out a system that kind of works a little bit better, where I would just take a bunch of short naps during the day, and then I would sleep. I would try to go to bed early at night, and then I would wake up early in the day to do all my homework and stuff. And that was a little bit better because at least I forced myself to have an amount of sleep, right? But something suspicious started to kind of foster itself over the years. And so this is the big thing that I'm gonna talk about here, right? So starting in middle school, when I would lay on my back, I would start to feel this weird sensation of my throat touching itself. It felt super gross and annoying, and I hated it. Now, well, over the years, that sensation of my throat touching itself back here only grew more and more present. And I was just dealing with chronic insomnia, taking super long to fall asleep, waking up way too many times during the night, etc., etc. College starts, and my sleep, I'm nocturnal. I'm basically nocturnal. I'm a nocturnal human being. Like the moment the sun sets, I'm wide awake. The moment the sun rises, I am able to sleep so naturally. It didn't make any sense. And then, around when I was 22 years old, I started to wake up in the middle of the night in a very different way than I would in high school. I would fall asleep and then wake up and my heart would be racing. Like as if I don't know, as if I was on a roller coaster or something. Like I would be in fight or flight, you know? And I wouldn't be having nightmares or anything. It was just I'd just be asleep, and then whoa, and my heart would be like beating super fast and super hard, right? That continued until I was, well, it continued. It just kept going, you know? And then eventually, by the time I was 25 years old, I started to snore really bad, to the point to where I would wake myself up snoring. You know, the sound of my own snoring would wake me up. And I started having these sleep paralysis dreams where like that appeared to be inspired by like a story of something that happened that I read about, where like there was this girl that was like in PE one day, and she heard like a really loud bang that no one else heard. Like it sounded like the bang came from behind her head or something, but no one else heard anything. And she was like, wow, was there an explosion or something? And then she died a couple hours later because she had a brain aneurysm. Like a blood vessel just exploded in her brain. And so my sleep paralysis dreams were basically based in my bed, and I would hear a really loud bang inside my head or behind my head, and I would start sinking into the bed in a really scary way, like as if like my body was made out of bags of sand. Just like a really deep, inescapable feeling of sinking further and further into the bed, unable to move. And that would be a reoccurring sleep paralysis dream that I would start having a lot. And then those moments when I would wake up with like a racing heartbeat, that got worse. I started waking up gasping for air, like I was out of breath, like I was suffocating, like I couldn't breathe. And in 2022, I finally like just mentioned it to my doctor. I was originally there to like ask my general practitioner about like something else. I think like I sprained my ankle or something. But then I also mentioned, oh yeah, also like, is it normal to like I assume this is just part of like getting older, you know, because like I'm 25 and like I'm in my like mid-20s, right? And so like I'm getting closer to the age of 30, which is where like apparently like I don't know, like your body starts to reach a new stage of aging or something. So like, is it normal for like to wake up in the middle of the night like gasping for air and stuff? Is that a normal thing people experience? And she was like, no, that isn't. You might have sleep apnea. Let's get a sleep test done. And so she prescribed me a sleep study, an at-home sleep study. I think I actually have some pictures that I took around that. Let me see if I can find them. So this. I was basically hooked up to this. There was a microphone taped to my neck or like my chest thing, and then an oximeter taped to my finger. And so also I didn't have a beard back then. This would detect any time my breathing would stop while I was asleep, and this would detect, or like it's snoring, and then this would detect how like any fluctuations in my blood oxygen levels. So this was basically all I had to deal with for the at-home sleep study, right? And then the results of that at-home sleep study came back, and it was like, yeah, there's something kind of suspicious going on. It seems like your breathing is stopping while you're asleep, right? And there's actually a lot that I left out leading up to this moment, because this was in 2022. I was dealing with some really terrible shit. I was in a really low point in my life, which will make sense after I talk about this, right? So around April-ish, I had a very severe memory loss episode that lasted 4 to 5 days. And what that looked like was, it was like I was forgetting who I was. It was like I was losing something really important, like some kind of identity of myself. Like it felt like something was flying away, and I was trying to grab my memories or whatever, but I couldn't reach out and hold them back, you know? And a lot of confusion. I was lost in my own bedroom, not sure where I was, like what time, like what, who, what, huh? For those 4 or 5 days. Then the next 6 months after that was like a lesser version of that. So I was having like a severe, like I could only, like the best way I can describe it is it looked like I was coming down with dementia. Like I was like Dory from Finding Nemo at a certain point, where like literally one moment I'll be like talking and then I'll be like, huh, what was I talking about? Wait, what was I doing? Like constantly. So it got to a point to where every other sentence I would just go blank. My mind would be completely blank, and it would feel like if you think of like memories as like nerve connections between neurons, like where there used to be a connection, there was now a gap, and just this very loose feeling of a connection that used to be there. And I would lose track of what I was saying constantly. So like right now, I'm able to hold my sentences together and complete my sentences and keep the conversation flowing. I wasn't able to do that. I was extremely forgetful. Short-term memory, basically gone. Long-term memory, weakening. And it was like, holy fuck, there's something wrong with me. Something like that's all I could put together. Like something's wrong with me. Something scary is going on. And I got really sick. Unfortunately, I don't want to go into too much detail about what was going on in my life around all of this, but basically it was really bad. And I turned into a different person. Like if you think of like a senile old man, think of like someone who's like completely lost, you know, like a shell of their former selves and stuff. Yeah, it was bad. And there's like a huge fallout and stuff, and then I was on my own again. And I came back, and then I started like, despite everything still being fucked, I forced myself to like get a job and everything, and you know, and then now we're back to the sleep study. So there was a lot leading up to this sleep study, and it's like, wait, okay, so now there's a few things we need to do. Have I suffered brain damage? Because this kind of sounds like brain damage, you know? So I went to a neurologist, and yeah, I had an MRI done on my brain to see if anything biologically, structurally was like wrong with my brain, compromised. And while I was in the waiting room, there were these 2 other patients that were also waiting to be called, and they were both like at least in their 50s. One of them had experienced a traumatic brain injury in their teen years, but they seemed to recover fine, and everything was fine until they hit like the age of 54, and then they suddenly forgot who they were. Like their entire identity just completely vanished. And then the other person had Parkinson's. And so like I was just kind of like, I was sitting next to them, so I was just hearing everything they were sharing with each other. And then I started sharing like my experience, you know, the whole thing where it's like those 4 or 5 days of really intense memory loss, cognitive decline type feeling, and just being lost, and like, you know. And I'll never forget the validation that I got when they like responded, and like basically their response was like, I've never heard someone explain how it feels to have what I have with such clarity. Like, that is on point. That was like, on one hand super validating, on the other hand really fucking scary, because I was only like 24, 25 years old. Like, I'm way too young. Thankfully, after the MRI scan, the doctor told me, the neurologist there told me, like, there's nothing wrong structurally with your brain. Like, your white matter, your gray matter, whatever. Like, your brain looks healthy. So, oh man, that was a relief. That was a huge relief. But then something was still off. So, basically, they set me up with an EEG. And so I basically had, so they had me wear a durag, but I basically had all these wires, temporarily glued to different spots on my head. This is what it looks like. This is what an EEG looks like. So I had this on for 3 days, and I brought it home with like a backpack and stuff. There's like a little iPad on the backpack, and these were legit my brain waves recorded live. And so they just told me to do what I would normally do on an average day. And so I actually played Osu while doing this, and yeah. So I wore that for 3 days, and once those 3 days were over and I went back to a clinic, they like took it all off and let me like clean up my hair and stuff. I eventually got the results back, and it was normal. Somehow it was also normal. And then I did an in-lab EEG where they had me like set up with a laptop, and like I had to do a bunch of tests with all the wires on my head and stuff. And then they had me do a memory test, which I absolutely bombed. Like, it felt like I shouldn't have bombed it, because one of the few things that I did strongly remember was how good my memory used to be when I was in middle school and high school. It actually used to be really good. I would remember things and like conversations with other people that no one else would remember. Just super small details. I would have like such clear recollections of previous days from start to finish. That kind of memory. Yeah, after all those tests were done, it was all normal. So everything at the neurologist came back normal. So I was like, okay, let's get an in-lab sleep study done. So it was interesting, because when you think of an in-lab sleep study, you think like, you're thinking like, oh, it's going to be like a laboratory, like it's going to be super sterile, and they're going to have you sleep on a patient bed. Nah. The place was set up like a senior living home. It smelled very strongly of cinnamon, and it just felt like a place where like older people would live. But that makes sense, because like a lot of like the clientele that would get this kind of stuff done would be like in their 40s or 50s or older, you know. So I did the sleep study, and that was the first time I was hooked up to a machine called a CPAP. So a CPAP is a continuous air pressure continuous positive air pressure machine, right? So the machine's right here, and then it creates a positive air pressure flow and forming a seal around your breathing holes, and pushes air into your lungs. And what that does is it basically forces air into your airways, so that your airways can't collapse like this. So this is a normal airway, the nose, nasal passages, the mouth. going in. And then with obstructive sleep apnea, everything collapses. So I was hooked up to a CPAP for the first time in my life. And at first it was harder to breathe than without the CPAP, but it was because they were calibrating it. They were calibrating the air pressure strength according to how severe my apnea was. And so they were just spending the whole night tuning it. So like the first 3 or 4 hours I couldn't breathe. Like imagine like plugging your nose and trying to breathe through a straw, and I can guarantee you it was harder to breathe than that. But eventually, after a few hours, I finally fell asleep. And I got like a solid 3 hours of sleep. But even though that doesn't sound like much, when I woke up, like I could breathe pretty well. Like it seemed like they found a good air pressure, and they disconnected me from the device, and they gave me a clipboard and a pen, and they had me fill out stuff. For the first time in so fucking long, my mind felt super clear. Like it was quiet. There was no pain, like headache pain or anything. And my ability to hold a pencil and write words, like my hands were so dexterous, dude. I have full control. I was no like, and for reference, like my entire life up until this point, well, like relatively speaking, like the past 5 years up to this point, like anytime I woke up, like getting out of bed, I'll be a stumbling mess. Like it was like as if I was drunk or something, you know, like that lack of like coordination. It would take like at least 2 hours for my body to like fully wake up or something. And even then I would still be super clumsy, tripping over nothing. And I was just like, holy shit. And I remember the last question on the questionnaire was asking about any dreams I had. And I assume it's just for fun, you know, like, oh, what, did you have any funny dreams? Okay, so like I had 2 dreams that I could remember. The first dream was the technician, like, for some reason I wouldn't stop shaking my leg in bed. So like I had a dream that one of the technicians, the sleep techs, came in to basically what was set up like a normal bedroom, and pull off the blanket and injected my leg with like a huge syringe, just some unknown like medication to make my leg stop like shaking. So that was my first dream. My second dream was a lot deeper, actually. My second dream was a dream of me being in a furniture store, trying out one of the beds, and suddenly being paralyzed and not being able to move or get out of the bed. And I was just stuck in that bed, in that furniture store, watching all of these people live their lives, just like growing up and like hanging out with friends and like, or their families, and like just walking around and like, you know, living life. And I remember writing down on that clipboard, like, yeah, I had a dream where I was stuck in bed watching other people progress through their lives while I stayed stuck in the same spot, stuck in bed, living my life stuck in bed. Yeah, that's exactly how life had been feeling for a long time for me. Like, most of my time was in bed, because the way I would, like around 2018, around 2020, while this was all still undiagnosed, I found that like the most restful sleep I could get would only happen if I slept 12 to 16 hours a day. I'll say that again. 12 to 16 hours a day asleep. And even then, my body would still feel fatigued. But at least I would be able to have energy to like do things. And that was actually how much I was sleeping when I made that PC optimization series on my channel. Holy shit. Yeah. And that was like a coping mechanism before my sleep apnea, my undiagnosed sleep apnea got even worse. It got like, I was sleeping my life away. I was basically sleeping my life away, literally, like in an actual literal sense. So yeah, eventually the results of the in-lab sleep study came back, super accurate readings and everything, because it was in the lab. They super accurate like values and stuff, right? So there's this thing called an AHI. I forget what it stands for, but basically it's the value that measures how severe your sleep apnea is. Anything like below a 9 is like very light and not severe, and anything that's 30 and over is severe and life-threatening. I was borderline severe. My AHI was 29.8, which meant that my breathing on average while asleep would stop once every 1.5 minutes. And my blood oxygen levels would drop as low as 80% multiple times during the night. And for reference, people should contact a healthcare provider if their oxygen saturation readings drop below 92%. If oxygen saturation levels fall to 88% or lower, seek immediate medical attention, aka call an ambulance, because that's life-threatening. I was seeing values as low as like 84, 82 multiple times. So it was really bad. And dude, I had been living with this for multiple years, at least since 2018. But if we go as far back as to that first night when I felt the back of my throat touching itself, just that tiny bit, before it got to the point to where I am today, where all I have to do is just lean back a little bit, and wow, the whole, like, I feel it going all the way across. It's just touching itself. Like, I'm not even laying down. If we go all the way that far back, that would be that's potentially when it would have started. And there was I remember reading the story online of like another person's experience where they went all these years seeing all these doctors. Something was terribly wrong with them. They had so many health issues, and they slept terribly, and their doctors couldn't figure out anything. And it was like that for them since they were a teenager, like in middle school. And then they finally, like at the age of 28 or 30, got diagnosed with sleep apnea, and all their problems went away. Very similar situation to mine. That's like half of their life gone. Half of my life was spent struggling with an undiagnosed, life-threatening condition. Because if you think about it, anytime my breathing stops, there is a % chance that my breathing doesn't start again. For some people, it goes away if they lose weight. Like if you're obese and like there's a lot more like tissue around your neck, that's a lot more weight, and structurally it just collapses when you lay down, right? That's why like people who are overweight or obese, it sounds like they're constantly breathing heavily. That's why. It's because there's so much mass around their airway that's just the sound of the air like trying to go in and out. The sound of their lungs struggling to breathe. In my case, that might not be the case, because like it's still present even when I'm not overweight. I am slightly overweight. I'm like borderline right now. I blame Christmas and Thanksgiving. But it does improve when you're lower weight. But like for a good amount of people, it's a lifelong condition that they just have to live with. And so I can actually show you. Let me, like, it's not on camera right now, but I can get my machine and stuff and show it on camera. So this is my CPAP machine. And mine comes with a humidifying tank. So that it doesn't dry out my airways. And then this is the tube that connects on one end to the machine, and then the other end connects to my mask. Right now, I have 2 masks. Reason is because one mask doesn't hurt my face as bad. And then the other mask is comfortable until it starts hurting my face. So this is the full face mask that I wear, right? Like this. So this mask goes around the whole face and presses down on either side of your nose. You can try this right now, actually. If you like take your fingers and like press down on either side of your nose right here and try to breathe, it's a bit harder to breathe, right? So the downside to that full face mask is that it actually makes it harder for me to breathe through my nose. Which is why I have this mask, because this mask doesn't do that. It only covers my nostrils and then just my mouth, right? The problem with this mask, though, is while it is infinitely more comfortable than this mask and way more easier to breathe through my nose than this mask, it actually hurts so much. This spot right here turns into a skin sore, and it bleeds because of all the pressure that the mask puts on that one spot on my face. If you look, and it's basically doing the same thing that this mask did to the bridge of my nose. So if you look at my nose, you'll see there's a scar right here. Yeah. I didn't used to have that. The way I figured out a way to stop it from like opening back up and bleeding and stuff by putting a Band-Aid over it. Like I put some lotion on it, and then I put a Band-Aid over it, and then I put the mask on over that. But yeah, very painful. It was very painful when it was like an open bleeding wound. I don't mind sharing this kind of stuff because, I mean, it's my life, you know? And honestly, like, if it brings awareness to anyone else who is experiencing something similar but they don't know, like, what it is, fucking do it. You'll start to feel alive again. So, within 1 month of me using a CPAP, right, I actually started to feel awake. You know, because before that, like I would be stuck in this weird Twilight Zone type feeling where it's like somewhere between being awake and asleep, but never fully awake. I could tell when I was in a dream, but it never felt like I was awake. And I would feel more alive in my dreams than I would in real life. So I think that's kind of it. Like I've been using the CPAP for like just over a year, in order to like reverse all of like in order for me to fully heal, you know, I need at least 1 or 2 years of consistent use, and then I'll be able to tolerate disturbances in sleep patterns a bit better. Not gonna lie though, 3 out of the 12 months in 2023, yeah, I only had consistent, healthy amounts of sleep for 3 of those months. The other 9 months were very inconsistent. Yeah, not good. So, yeah, even with my sleep being inconsistent as it is right now, as physically painful as it is, to like not have a consistent, healthy amount of sleep on a week-to-week basis, it's still nothing compared to what life was like before I started using the CPAP. So, yeah, if anything that I just described sounds familiar, please bring up the topic with your doctor. At least do an at-home sleep study. At least an at-home sleep study. You could find out something that could massively improve your life. The difference between like it could be the difference between like not feeling alive and actually feeling alive. I don't know if that sounds weird, but like it's like not feeling awake versus feeling awake, like being actually present in your own life, if that makes sense. They're like it affects, it's a condition that affects every aspect of your life, you know, like your ability to have energy to do anything in life is affected, so it affects everything. Your relationship with other people, like your academic life, your social life, your career, like everything, personal life, everything, hobbies even. So Cindy, when you started mentioning your sleep problems, I really wanted to bring up my own experience, because some of the things you said, like needing to sleep 12 hours, sounds super sus to me, because it sounds like what I went through when I was undiagnosed. And so I highly recommend seeing a doctor about it. Just bring it up. They will find it sus. But if they don't find it sus and they think it's hormonal or something, which it very well could be, just ask them, hey, I think I want to get a sleep study done, because it could get worse. And it might be difficult to get a sleep study if like your insurance is like really picky, like there needs to be like a really specific symptom or something, like you're waking up gasping for air in the night. Then there should be a way to like figure that out. Crazy that you came for an OSU stream and now you're thinking of bringing this up when you visit your doctor, because you have so many of the same stuff happening right now. And also your friend has said that your situation sounds like apnea because your dad has it, but you've ignored it until now. It's a very serious thing. It's life-threatening. So yeah, please do talk about it with your doctor, because yeah. Don't wait until it gets worse, because you don't want to you don't want to wait. the earlier you catch it, the better. Yeah, no problem. As a bonus picture though, here's a picture of me in that in-lab like test environment as a neurologist before I did the in-lab sleep study. They had me hooked up to another EEG. They gave me this like stick with a red button. It looks like I was like about. It looks like one of those like evil mastermind type things where it's like a switch to like release nuclear weapons or something, or like explode the Eiffel Tower or some shit. So I thought it was funny.